This is the update from the Thyroid Trust in the UK for the Thyroid Federation International AGM September 2021. The Thyroid Trust is a patient-led charity which works closely with leading medics. We're still very new and small, but we are ambitious and determined to make things better for our fellow thyroid patients. And despite the challenges of the last 12 months, we've continued to be very active through the pandemic. We have continued to develop and refine our strategy, and I'd like to start this presentation by summarising our strategic aims so that you'll understand what it is that we're trying to do. We want to raise the profile of thyroid disease and have it taken more seriously, to support, empower and better connect our community of people affected by thyroid disease, to promote evidence-based understanding of thyroid disease, and to develop our organisation so that we can become a sustainable, well-resourced charity and increase the impact we can make. We're already firmly established as a strong voice for patients. The cornerstone of our work is our events programme, and we continue to organise 6 information events a year with top speakers, which often attract more than 100 attendees. And we're now also holding smaller, more intimate thyroid cafe style support events. All of these have of course been online since March 2020, but we hope soon to start meeting face to face again in central London. The advantage of doing things online is that it makes it easier to record and share content on our website and YouTube channel. We now have a growing library of information videos featuring speakers from our events. In the last 12 months, we've added talks from Dr. René Houndekamp on hypothyroidism from both ends of the stethoscope. Dr. René is a GP and a thyroid patient herself and was on the committee for the development of the NICE guidelines for thyroid disease assessment and management, which we fed into. Torquil Watt on measuring quality of life in thyroid patients, Professor Atul Kalhan on lessons from a patient that a book cannot teach, Dr. Bernard Koo on new research into thyroid hormones and COVID-19 patients, and Professor Simon Pearce of Newcastle University, who is President of the British Thyroid Association and editor of the European Thyroid Journal, on getting the best treatment for hypothyroidism, which is a talk he's delivering in 2 parts. Part 1 can be watched online now, and Part 2 is being delivered live later this month and will also be shared online afterwards. We have more videos currently in production, a shortened version of Simon Pearce's talk on Graves' disease from last December, and a talk by Dr. Peter Taylor on levothyroxine treatment and cholesterol in hypothyroidism will both be added to our library soon. Also on our YouTube channel, we have added a new awareness video made for us by TVGP Dr. Catherine Millington Sanders with help from her editor at ITV, a fun video created for us as part of our celebration of International Thyroid Awareness Week by artist and thyroid patient Vicky Roden, who we met through the University of Birmingham Institute of Metabolism and Systems Research, whose event on the power of the patient voice she and I spoke at this summer, and who kindly ran a creative thyroid cafe for us in May, and as part of our International Thyroid Awareness Week celebrations, and a new series of patient interviews, the Thyroid Trust 24 questions, hashtag TTT24Q, which is all about amplifying patient voices and helping us all feel less alone. We were honoured that well-known author and broadcaster Michael Rosen very kindly agreed to be included in this series, and his interview has been particularly popular and helped us gain more awareness. Michael spoke very movingly of the impact of thyroid disease on his life, including being unwell, slow and spaced out for 15 years before he was diagnosed with hypothyroidism. This interview was another part of our International Thyroid Awareness Week activities. We also partnered with Famadan Journal, who published a special issue of poetry for World Thyroid Day, and we used the theme of Thyroid Champions, highlighting the Scottish Parliament World Thyroid Day motion, as well as holding events and butterfly-themed fundraising. But awareness raising is important to us all year round. We're grateful to the many clinicians and patient volunteers who've either written articles or agreed to be interviewed for press, TV and radio opportunities we've secured, and our own channels, such as our blog. We now have a partnership with UK Health Radio in their Triangle magazine, and we've had coverage in a wide range of other local, regional and national media, as well as general awareness raising stories such as that from the Scottish Sunday Post, shown on the bottom left of this slide from the 29th of August. We have continued to be very active in both behind the scenes advocacy work and awareness raising of the ongoing issues around access to T3 for those patients who need it, which is still a huge problem in the UK, despite the clearer national guidance, which we were influential in having published, and the cost reductions which have come about from having more licence holders in the market. The Competitions and Markets Authority concluded their investigation into the original licence holder and their backers last month and issued a fine of £100 million to them for artificially inflating the price. We published another major report in March 2021, highlighting the postcode lottery which still exists across the UK, and in response to that report, NHS England have now told us that NHS clinical commissioners will write to all local health authorities to reinforce to them they are expected to follow to allow T3 to be prescribed in line with that national guidance when levothyroxine has failed. This was initially promised before the pandemic, and it has been challenging to keep the pressure up, but we will continue to do so as it's clearly so important to affected patients. We're grateful to everyone who's supported us to do all of this and more in the last 12 months, and we hope to be able to continue to do more in the year ahead.